Hello, my name is Gail Orum, and I am presenting Geriatric Black, Indigenous, People of Color Health Disparities, Preparing Pharmacy Students. I'm presenting on behalf of my co-authors, Daniel Kudo and Dr. Nazir Rashid, who assist with this course that I'm about to describe in this presentation. The purpose of this descriptive poster is to describe a curricular innovation using a journal club, additional articles, and a case study, all to help the students to develop critical thinking, clinical decision-making skills to address health disparities in BIPOC older adults, and to incorporate interprofessional practice models in doing so. The first model is from the American Geriatric Society, Health and Aging, that has 6 domains identified as being essential for entry-level healthcare professionals to treat geriatric patients. The second model is the one that is the Geriatric 5 M's model, used in medical schools in Canada and in the United States of America, that focuses on what matters most: mind, mobility, medications, and multi-complexity. Those models were added to the pharmacist patient care process model, that is the multicolored wheel here at the bottom of the screen, that is employed in all pharmacy schools that are accredited in the United States. All of these for the students to work together to develop a comprehensive geriatric assessment that focuses not only on the patient, but also on the environment, and includes health disparities and concerns with caregivers. So the process or the methods is that teams of students were assigned a journal club article based on a topic in geriatric care, whether it's urinary incontinence, delirium, dementia, and the students had to present within 15 minutes using a 36-point rubric, which was shared with the students ahead of time. The remainder of the class was assigned an article on the same topic, but with a focus on a BIPOC population. As you can see from the diagram, the table here on the bottom right-hand side of the screen, the de-prescribing in older people was a team article, and that was paired with the class article of polypharmacy and depressive symptoms in US-born Mexican-American older adults. So this is all of the journal clubs were done like this. After the entire class discussed the journal club articles and the corresponding class articles, the class reviewed a case study and provides a comprehensive geriatric assessment for the patient in the case study. And then there's a class debriefing session to assess how the students felt about their progress and their own clinical decision-making skills. Keep in mind that these are students that are third-year students in a 4-year PharmD program. So they are at the bottom of this geriatric learning pyramid, and this is an elective topic. So this is foundational for their development. The results slide is very busy, but it identifies the rubric scores, and you can see that in the first journal club experience, there are 2 journal clubs in each session, in each class, each course offering, and the journal club scores improved on average by 3.75 points on that 36 scale, which is a considerable improvement. For the course evaluations, you can see that most of the students either strongly agreed or agreed that the course topics flowed smoothly, there was value in active learning exercises, that the formative assessment helped the students to achieve mastery, and that the students were satisfied with the course. There are about 7 topics or questions that are asked of students, and I selected the ones that were related most closely to this assignment. And then finally, there are the anecdotal comments from the students who found the journal club presentations helpful and that they gave them extra practice. They like to review the disease states to get more experience with presenting. And the only complaint was that they felt they were running out of time with the presentation. Finally, in conclusion, the journal club assignments are effective in improving pharmacy students' knowledge, critical thinking skills, therapeutic decision-making skills to address health disparities using interprofessional frameworks. The link is to the poster, and my references are included below. Thank you for your attention.